10 hernia symptoms, men, and what to do. Are you experiencing persistent, unexplained discomfort or noticing an unusual bulge in your groin or scrotum? Did you know these could be hernia symptoms? It's important for men to be aware of the common signs of a hernia so they can seek timely medical advice. Before we dive into 10 key hernia symptoms men should watch out for, and what natural steps you can take for comfort while awaiting professional help, please remember this video offers general information and should not replace advice from a medical professional. If you suspect you have a hernia, consult a doctor for proper diagnosis and treatment options. The science-backed resources supporting the information presented in this video can be found in the description below. Welcome to our daily health. A hernia occurs when an organ or fatty tissue squeezes through a weak spot in a surrounding muscle or connective tissue. While hernias can occur in various parts of the body, they too are common in the groin area in men. Recognizing the early symptoms of a hernia is crucial for managing the condition effectively. This video will outline 10 common hernia symptoms that men may experience and provide natural tips for managing discomfort while you seek professional medical guidance. Here are 10 hernia symptoms that men may experience, along with more in-depth explanations and natural approaches for temporary comfort. Number 1. A noticeable bulge in the groin or scrotum, a classic sign of an inguinal hernia. One of the most frequently reported hernia symptoms in men, especially concerning an inguinal hernia, is the appearance of a visible bulge in the groin area or, in some cases, extending down into the scrotum. This bulge may appear quite suddenly, perhaps after a bout of heavy lifting or intense coughing, or it can develop more insidiously over a period of weeks or months. It is often more pronounced when you are standing upright, engaging in activities that increase intra-abdominal pressure, such as coughing, sneezing, or straining during bowel movements, and may temporarily disappear or reduce in size when you lie down. This occurs because a portion of the intestine or fatty tissue is being forced through the weakened inguinal canal, a natural passageway in the groin that contains the spermatic cord in men. Number 2. Pain or discomfort in the groin, especially when lifting or straining, a key indicator of a developing hernia. Experiencing localized pain or a persistent feeling of discomfort in the groin area, particularly during activities that increase pressure within the abdomen, such as lifting heavy objects, engaging in strenuous exercise, or even straining during bowel movements due to constipation, can be an early hernia symptom for many men. This pain can vary in intensity, ranging from a dull nagging ache to a sharp pulling or burning sensation. It often subsides or lessens when you are resting or lying down. The discomfort arises from the mechanical pressure exerted by the protruding tissue on the surrounding muscles, nerves, and other sensitive structures within the groin region. Number 3. A heavy or dragging sensation in the groin, a subtle but significant hernia symptom. Some men with a developing hernia, particularly in the inguinal region, may experience a peculiar heavy or dragging sensation in their groin area, even in the absence of a clearly visible or palpable bulge. This feeling can be persistent throughout the day or may occur intermittently, often worsening with prolonged standing or physical activity. It is believed to be caused by the weight of the protruding tissue, even if small, exerting downward pressure on the supporting ligaments and tissues within the groin and potentially affecting the spermatic cord. This subtle hernia symptom should not be dismissed, especially if accompanied by other forms of groin discomfort. Found this video valuable? Like and subscribe for more health tips. Drop your comments or questions below. We're eager to hear from you. Please share this video to help others. Number 4. Swelling in the scrotum, a clear sign of an inguinal hernia's descent. In certain cases of an inguinal hernia in men, the protruding bulge can extend downwards through the inguinal canal and into the scrotum, causing noticeable swelling. This scrotal swelling may fluctuate in size throughout the day, often becoming more prominent when standing or straining and potentially reducing when lying down. It can be accompanied by a feeling of heaviness, a dull ache, or a general sense of discomfort within the scrotum itself. This occurs as the portion of the intestine or other abdominal contents travels down the inguinal canal and into the scrotal sac, which normally houses the testicles. Number 5. Increased pain or discomfort towards the end of the day, a hernia symptom exacerbated by daily activity. Men who have developed a hernia, particularly in the groin region, may observe that their pain or discomfort in that area tends to gradually worsen as the day progresses. This is often directly correlated with prolonged periods of standing, walking, or engaging in any form of physical activity that increases intra-abdominal pressure throughout the day. The cumulative effect of this pressure on the weakened abdominal wall and the protruding hernia can lead to increased inflammation and irritation of the surrounding tissues and nerves, resulting in heightened discomfort by evening. Resting, especially lying down, often provides some temporary relief from this activity-related worsening of hernia symptoms. Number 6. A dull aching sensation that radiates into the thigh, a less typical but possible hernia symptom. While localized groin pain is the more common presentation of an inguinal hernia in men, some individuals, particularly those with a femoral hernia, which is less frequent in men compared to women but can still occur, might experience a dull aching sensation that seems to originate in the groin, but then radiates downwards into the upper portion of the thigh. This occurs due to the proximity of the femoral canal, the site of a femoral hernia, to major nerves that travel down the leg. The pressure on these nerves from the protruding tissue can cause this radiating pain, which might sometimes be mistaken for a pulled muscle or other musculoskeletal issue in the leg. Number 7. Constipation or difficulty with bowel movements, a potential consequence of an incarcerated hernia. In certain more serious situations, a hernia, most commonly an inguinal hernia, can become incarcerated. This means that the protruding portion of tissue, usually a loop of intestine, becomes trapped within the weakened abdominal wall and cannot be easily pushed back into its normal position. This incarceration can sometimes lead to a partial or even complete obstruction of the bowel, resulting in symptoms like constipation, difficulty passing gas, abdominal bloating, and discomfort. This is a more severe symptom that requires prompt medical attention, as it can potentially lead to a strangulated hernia where the blood supply to the trapped tissue is compromised. Number 8. Nausea or vomiting, a serious sign indicating a potentially strangulated hernia. If an incarcerated hernia progresses to strangulation, where the blood supply to the trapped tissue, usually a segment of the intestine, is cut off, it becomes a critical medical emergency. The lack of blood flow can lead to tissue death, gangrene, and the release of toxins into the bloodstream. Symptoms of a strangulated hernia include sudden severe pain at the site of the hernia, a firm and tender bulge that cannot be reduced, and systemic symptoms such as nausea, vomiting, fever, and a rapid heart rate. Immediate surgical intervention is necessary to restore blood flow and prevent life-threatening complications. Number 9. A persistent feeling of fullness or heaviness in the abdomen, potentially indicating a larger hernia. Larger hernias, particularly umbilical hernias occurring near the belly button, or incisional hernias developing at the site of a previous abdominal surgery, might not always present with significant localized pain, but can cause a persistent and uncomfortable feeling of fullness, pressure, or heaviness within the abdomen. This sensation can be more noticeable after consuming meals or during periods of physical activity that increase intra-abdominal pressure. The sheer size of the protruding tissue mass can contribute to this feeling of abdominal heaviness. Number 10. Sudden severe pain at the site of a previous hernia repair, a red flag for potential complication or recurrence. Men who have previously undergone surgical hernia repair and subsequently experience a sudden onset of severe pain at or near the surgical site should seek immediate medical attention. This could be indicative of a recurrence of the hernia where the repair has failed, or a complication related to the previous surgery, such as an infection developing at the surgical site or damage to surrounding tissues. Prompt medical evaluation is crucial to accurately diagnose the cause of the pain and implement appropriate management to prevent further complications. Natural tips for managing hernia discomfort while awaiting medical advice. Number 1. Gentle rest and activity modification. Avoid any strenuous activities, heavy lifting, anything over a few pounds, or exercises that exacerbate your hernia symptoms. Rest when you feel discomfort, and modify your daily activities to minimize strain on the affected area. Number 2. Supportive underwear or truss with doctor's guidance. Wearing supportive underwear that provides gentle compression to the groin or a specifically fitted truss, a supportive garment designed for hernias used only under medical advice, might offer some temporary comfort and help to keep the hernia reduced. However, a truss is not a long-term solution, and should only be used as directed by a physician. Number 3. Dietary management to avoid straining. Focus on consuming a diet rich in fiber from fruits, vegetables, and whole grains, and ensure adequate hydration by drinking plenty of water throughout the day. This helps to maintain soft and regular bowel movements, reducing the need to strain during defecation, which can worsen hernia symptoms. Number 4. Over-the-counter pain relief. Consult a doctor first. While not a natural cure, over-the-counter pain relievers, such as ibuprofen or acetaminophen, may provide temporary relief from mild hernia-related discomfort. However, it is crucial to consult your doctor before taking any medication, especially if you have underlying health conditions or are taking other medications. Number 5. Maintain a healthy weight. Excess body weight can place additional and unnecessary pressure on the abdominal wall, potentially worsening existing hernias and increasing the risk of developing new ones. Maintaining a healthy weight through a balanced diet and regular light exercise, as tolerated and advised by your doctor, can be a supportive measure.